Well, I think it's been become apparent over some time now that the way that public services are delivered in Essex is not working as well as it should. We have a huge target to meet in terms of reduced funding, and it's really important to everyone in Essex that we maintain and, if at all possible, improve the outcomes for our residents.
Community budgets, I think, are essential to achieving reform. No one's going to deny that we live in extraordinary challenging times.
Why do we need community budgets to achieve healthcare reform? Because quite simply, a vast number of our patients, particularly those who are elderly, disabled, mental health, learning disabilities, we can't achieve good health outcomes unless local government, other organisations, third sector and the health service all work together.
One of the utmost priorities for business is to get a skilled workforce. And the current arrangements clearly are not delivering that, or at least not delivering it in the quantity that business requires. So we have to approach this differently because we owe it to our young people to find them productive jobs.
Harsh reality is, although we've got a very proud track record of partnership working in Essex, more of the same, whilst very worthy and helpful, isn't going to deliver the step change that we need. So we need a fresh approach to redesigning services. We need to move at speed. We've really got to crack on. We need to leave our organisational badges at the door. We need to put the citizen at the heart of everything we think, say and do.
We have to work together. Offending is not just about criminal justice, it's about all the agencies who deliver community services in Essex working together.
What has stuck with me personally throughout the process is I suppose, the open-mindedness of the partners that joined the process. After some difficult moments, I think it's fair to say that all of them recognise the opportunities presented by this process, and at the same time also faced the very hard challenges their own individual organisations will have to surmount in order to make it happen.
I think for the health and social care interface, by the very nature of what we're dealing with, the key piece of advice is make sure that your stakeholders are fully informed and on board with your message. We've had to spend a lot of time making sure that our clinical commissioning groups are comfortable with the ideas, have the dialogue with their social care partners, that we've been using the early formation of the Health and Wellbeing Board to get a general buy-in to the overall strategy of what we're trying to achieve.
We spent 9 months producing our operational plan and business cases. It was a very, very intensive piece of work with a lot of people involved. So don't underestimate the time it takes to engage in this sort of partnership working, and it will need a radical change in the way that we all work together, and our workforces are going to have to change the way that we work, and very deep cultural change. So a lot of things to think about.
The key benefits in 5 or 10 years' time, when this is worked through, will be that we don't duplicate services, we have good shared information, and actually we work together, have to look at what we want to achieve. We have to acknowledge that it might not always be an easy road, but you really do have to stick with it. And the benefits won't necessarily come tomorrow, but in 5 to 10 years they will really be amazing benefits.
It's a new way of working, it's a fast way of working, it's complex, it's exciting, and you pick up bruises along the way, but we're covering more distance in 9 months than we may have done in the previous 9 years.